The patient is Mr. Don Smith, date of birth July 1st, 1985, age is 33 years old, weight is 265 pounds, height is 5'7". This is a male patient who was involved in a motor vehicle accident. The accident occurred 20 minutes ago, and the patient was unrestrained. The patient complains of pain in the left lower quadrant, left upper extremity, and left lower extremity and the head. The patient denies altered level of consciousness, dizziness, or chest pain, and the patient is morbidly obese. Pertinent medical history. This patient has a history of diabetes type 2. He states that his last hemoglobin A1C was 7%, and he tolerates oral medication well. He recently was checked for diabetic retinopathy. He has a history of hypertension and takes a beta blocker, BID, which is 2 times per day. He also has a history of GERDS, which is gastroesophageal reflux disease, and has stopped taking his medication and is modifying his diet in order to improve his symptoms. Vital signs and interventions. His blood pressure was 160/84. His pulse or heart rate was 108 beats per minute. His breaths or respiratory rate were 24 per minute. His oxygenation or pulse oximetry was 98%, and his temperature was 96.8 degrees Fahrenheit. He has a splint applied to the left leg. His left arm was placed in a sling, and he has gauze wrapped around his head, and the gauze is blood tinged. Review of systems. Integumentary assessment. Laceration located on forehead, above nose. Hematoma located 2 centimeters to the right of the laceration. Ecchymosis is located at the left elbow, which is a clinical sign from the compound fracture. Contusion observed in abdominal area. Hematoma is observed in left patella. Onychomycosis observed in bilateral feet. Cicatrix located in right lower quadrant, related to history of appendectomy. Musculoskeletal assessment. Patient denies whiplash, which could affect the cervical spine. He has arthralgia associated with pain in the left patella. Ostealgia related to the compound fracture of the left upper extremity. The patient will require an open reduction internal fixation, or ORIF, and a request consultation has been made for an orthopedic surgeon. Cardiovascular assessment. No history of cardiac events such as myocardial infarction, or MI, or coronary artery bypass graft, also known as CABG. No history of deep vein thrombosis, or DVT. Admits to stage 2 hypertension, HTN. Family history. The patient reports that his father died from complications related to congestive heart failure, or CHF. Respiratory assessment. The patient denies shortness of breath, or SOB. Patient admits to history of childhood asthma, but has not used a metered dose inhaler, or MDI, in over 20 years. The patient admits to sleep apnea. Family history includes a patient report that his mother died from complications related to chronic obstructive pulmonary disease, also known as COPD. Digestive assessment includes history of gastroesophageal reflux disease, also known as GERDS. Occasionally experiences dyspepsia or indigestion. The patient admits to having an appendectomy at the age of 11, and the patient recently admitted to having an ultrasound to diagnose cholelithiasis, or gallstones. Reproductive assessment. The patient has no children, admits to oligospermia diagnosis 5 years ago. The last semen analysis was performed 1 year ago, and the patient denies history of any sexually transmitted disease, or STD. Endocrine assessment reveals that the patient is a type 2 diabetic, takes oral medication BID or twice a day. Morning fasting blood sugar was 189. The last urinalysis revealed glycosuria. Nephrologist recommended a change in his diabetic medication to improve his blood sugars. The patient is positive for gynecomastia, which is related to his obesity, and the patient is morbidly obese. Nervous assessment. The patient admits to suffering from migraine headaches. He admits to diabetic neuropathy pain in bilateral lower extremities. He admits to having had shingles in 2014, which was localized to the right areola and thoracic area. The patient was diagnosed with adult-onset attention deficit hyperactivity disorder, also known as ADHD, in 2008. The patient admits to suffering from insomnia and uses meditation to assist with falling asleep. Physician orders blood work. The physician ordered a CBC, which is a complete blood count, PT, prothrombin time, hemoglobin A1C for his diabetes, and HCT for hematocrit. Pain medication that was ordered: analgesic, Tylenol, 500 milligrams every 6 hours for pain, and narcotic pain control is Demerol, 25 milligrams IV push every 4 hours for deep or somatic or humeral pain. Somatic referring to the body or muscular pain, and the humeral pain referring to the pain in his elbow from the compound fracture. Physician orders radiology, MRI of the abdomen. MRI stands for magnetic resonance imagery. CT scan of the brain. CT scan refers to computed tomography scan. Chest x-ray of the thoracic area, and x-ray of the left upper extremity related to the compound fracture. Our references were Fremgen and Frucht, our 2016 version of Medical Terminology, A Living Language, 7th edition. Thank you very much.